Distinguished participants, ladies and gentlemen, the PGI Virtual Road Trip Session 2, Enhancing Accountability and Effectiveness of Humanitarian Logistics Through a Protection, Gender, and Inclusion Lens is about to commence shortly. In the meantime, we would like to request all participants to reflect your meeting ID accordingly, as reflected in the comment box indicating your name and organization, please. Excellencies, distinguished participants, ladies and gentlemen, good afternoon. Welcome to the PGI Virtual Road Trip Session 2, Enhancing Accountability and Effectiveness of Humanitarian Logistics Through a Protection, Gender, and Inclusion Lens. My name is Amalia from the ASEAN Secretariat, and I will be the MC for today's webinar. The virtual road trip is part of the collaboration initiative between the Technical Working Group on Protection, Gender and Inclusion in collaboration with the United Nations Entity for Gender Equality and the Empowerment of Women. We welcome everyone to join us in this virtual road trip as a capacity building initiative to support the development and strengthen the skills on PGI in disaster management. Thank you everyone for joining us. To open this tour, may we invite Ms. Panapananan, Director, Foreign Relations Division, Department of Disaster Prevention and Mitigation, Thailand, to open the workshop. Ms. Panapa, please.
Thank you, Amalia. Distinguished panelists and participants, good afternoon. On behalf of the co-chair of the Technical Working Group on Protection, Gender and Inclusion, I am very pleased to welcome you to this focus session on enhancing the accountability and effectiveness of humanitarian logistics through the PGI lens. This topic is of particular interest to the DPDPM, not only in our role as the co-chair of the TWG PGI, but also as a host of the Delta warehouse based in China, Thailand. As we have diverse participants in the audience today, including those who may not yet be familiar with the existing regional arrangement within ASEAN, please allow me to briefly introduce, firstly, the Delta initiative, as well as the TWG on PGI. The Disaster Emergency Logistics System for ASEAN, or DELSA, was established in 2012 to allow for the swift provision of the relief items to the ASEAN countries facing disaster. It is composed of regional emergency stockpiles pre-positioned in Malaysia, the Philippines, and Thailand, and also integrated elements of the institutional capacity building and enhancing communications and awareness around the role of logistics in response in ASEAN. Next, as more recent establishment in 2021, the Technical Working Group on Protection, Gender and Inclusion brings together the ACDM, the ASEAN Committee on Women, the Senior Official Meeting on Social Welfare and Development, and the AHA Center to serve as an intersectoral platform to promote and technically support our ACDM working groups and other actors working toward the achievement of gender equality, elimination of violence against women, and protection of the empowerment of everyone at risk, including women and people with disability, through gender mainstreaming across the region. While various initiatives contributing to humanitarian logistics in the region, including DELSA and ASEAN ERAT, already integrated elements of gender-sensitive programming, we look forward to building upon the existing effort to ensure that everyone at least is reached in response effort. Today's agenda to help us further enhance the strengthening linkage between humanitarian logistics and protections, gender and inclusion. We will hear today from the number of panelists, including Malaysia as the host of Regional Warehouse of DELSA in Subang, represented by Ms. Murni Amin from the NADMA. Most importantly, we will hear from you as participants who have a key role in play in generating the recommendation that will be presented back to the plenary. And we look forward to your active participation in this discussion. Before we begin with today's session, please allow me to extend to you an invitation to our future capacity development session on PGI in disaster management, namely the session on protection, gender, and CBDRM on social protection and on diverse leadership. My colleague will place the registration link for the next session on June 29th in the chat box. And we would very much like to welcome your participation there also. Finally, please allow me to extend my thanks to colleagues at the ASEAN Secretariat, UNFPA and UN Women for their support in the organization of this session. I wish you all a successful session with a fruitful discussion. Thank you.
Thank you, Ms. Panapa. Distinguished participants, please welcome Ms. Prim Devakula, Gender and Disaster Risk Reduction Program Analyst, UN Women Indonesia, to lead the next session. Ms. Prim, please.
Good afternoon, colleagues, and thank you very much, Jakun Amy, for the opening remarks and Amalia for the introduction. My name is Prim Devakula, and I'm a disaster risk reduction analyst for UN Women, primarily working in the ASEAN sub-region. Just to give a sense of who's in the room with us today, your registrations told us we have a great mix of participants from academia to government, to intergovernmental organizations, to NGOs and private sector representing the full region. So I'm very excited for the conversation we'll have throughout this session. Please do feel free to introduce yourself more in depth in the chat. We'd love to get to know you and who's here. I have to admit that when the AHA Center reached out to us to see if we could connect on a session on protection, gender inclusion, and humanitarian logistics, I myself kind of had a moment of doubt. This isn't the typical forum that UN Women is normally invited to present in. What are the linkages between these two things? How do they connect? Is there not a certain amount of neutrality, quote unquote, in supply chain management? So these were some of the questions I had on my mind, and I'm looking forward to our conversation today to get to them in more depth. When I sat down and really thought about it, two things immediately came to mind really when we talked about the links between gender inclusion and logistics. One was the brilliant work that my colleagues over at UNFPA are doing on prepositioning supplies for gender-based violence and sexual reproductive health, and you'll hear from them shortly, as well as some great regional examples in ASEAN that have already integrated elements of gender. And again, you'll also hear from them shortly today as well. But the second thing that came to mind really was our sort of bread and butter as UN Women, which is this principle of substantive equality. I'm going to share a quick video that will explain this concept, and then we'll come back to a discussion on how it applies to this field of work. So here's a short video, and be right back.
CEDAW. What is CEDAW? In 1979, the United Nations adopted an International Bill of Rights for Women called the Convention on the Elimination of All Forms of Discrimination Against Women, that is CEDAW. Currently, it is one of the most broadly endorsed human rights treaties in the world, and the Global South actors have been instrumental in its creation. Every country which has ratified the treaty agrees to follow it. The CEDAW framework encompasses substantive equality, non-discrimination, and state obligation. Let's look at substantive equality. Substantive equality can be understood as equality of results between all genders. This means looking at the actual condition of women's lives as the true measure of whether equality has been achieved. Biases and stereotypes result in structural inequality, which grant special advantages to some people due to factors such as ability, literacy, class, ethnicity, sexuality, or gender. This advantage is called privilege. Privilege can essentially be understood as a historically occupied position of dominance. Patriarchy is a construct of male privilege that places women below men. Men tend to enjoy benefits of patriarchy, which outweigh most of the progress made by women. The justification for patriarchy attributes it to inherent natural differences between men and women. But difference is not the same as inequality. Men and women are different, but equal. Instead of genuinely addressing inequality, sometimes a protectionist approach is taken. The protectionist approach denies opportunity in order to maintain the status quo. For example, in some educational institutions, women are barred from using the library facilities at night, supposedly for their own safety. The formal approach acknowledges inequality by a token measure, but doesn't take any additional measures into account. For example, in cases where all genders can use the same library, but there is no infrastructure, no security, and no safety measures. The corrective approach takes into consideration the situation and various factors affecting women. For example, in this case, the library is open and accessible for everyone at all hours. There is infrastructure with lights, spaces, and security measures, as well as enforcement. The corrective approach leads to substantive equality. It ensures an actual change by recognizing differences, improving conditions and access, as well as creating systemic change. Thus, women have equality in opportunities, access to opportunities, and results.
With the framing of this video in mind, if we break down supply chain management and logistics in the humanitarian context, in line with this model proposed by HELp Logistics, we see 5 primary components. So preparedness, assessments and planning, sourcing and resource mobilization, transport and storage, and distribution. Let's take a minute and complete the Zoom poll that should be popping up on your screens just now. Around which elements you think could contribute to substantive equality or the equality of results between all genders in disaster management. You can make multiple choices in this segment. I'm just going to leave quietly for about 20 seconds for you to quickly vote. Okay, with about half of the results in, we see that people have selected across all of the different segments, all preparedness assessment, sourcing, resource mobilization, transport, storage, and distribution, although we are seeing the highest percentage in the area of assessments and planning, as well as in preparedness and sourcing and resource mobilization. We're seeing maybe less of an emphasis on this area of transport and storage. Thank you very much for your participation. We'll move on. We'll have a bit more of a discussion around these results as this little segment goes on. So before we move on, let me make this proposition that as the backbone of humanitarian operations, supply chain and logistics actors have critical roles to play in addressing the gender and age dimensions of disaster impacts. On this slide, we can see a selection of the ways of the impacts that we know of, for example, in education, where we see that where choices have to be made in the aftermath of disasters, it's often girls who first drop out of school. We see increased protection risks around sexual and gender-based violence, coupled with a decrease in access to necessary services. We see, for example, impacts on women's livelihoods, which are less likely to be captured in needs assessments with more restricted capacity to recover. We also see differential impacts in the areas of reproductive health care, as well as in unequal access to aid. Against this sub-regional context, when we think of gender logistics, as we saw in the poll, I think the two sort of red boxes are what sort of come up as the most common issues around gender, as we just discussed. When disasters strike, they often exacerbate pre-existing gender inequalities, making bad situations worse for women. And as we just touched upon, there's also this idea of gendered barriers to aid. This could be, for example, issues around the setting of distribution points. Can female-headed households carry and receive aid all the way back? Do they receive any security risks along the way or standing in line? Does the timing of distribution work for them and their schedules? Are there any other gendered ways in which they may be less able to access aid within this context? But as we all know, disasters also present an opportunity for us to do better. And so I want to move beyond these red boxes of what we know happens and into what we can do to make humanitarian supply chains more effective and accountable. As my colleagues at UNFPA will cover more preparedness and assessment in more depth, I'll leave that to them. But instead, I'll move on to two areas that are often thought of as neutral, although I was really pleasantly surprised to see in the poll that many of you also identified the gender issues relevant to sourcing and resource mobilization as part of where the gendered issues might come in. And the second issue is around transport and storage, and then challenging this idea of infrastructure or transport as being gender neutral. So firstly, thinking about the sourcing and resource mobilization and what opportunities might exist there to use what we call gender responsive procurement, which is the sustainable selection of services or goods that consider the impact on gender equality, seeking to enable women workers and women-owned businesses to benefit from these opportunities. Diversifying the supplier base to include women-owned businesses can mitigate business risks, procure small orders or specialized products can be done more quickly, and it can also demonstrate a company or an agency's commitment to diversity and gender equality. This links also to the area of localization, which was identified this morning in plenary as a massive part of the future of humanitarian logistics. That is, can we, while procuring life-supplying supplies, also contribute to key livelihood needs of those most affected within the area? One very small-scale example I can share here is thinking of my own procurement colleagues, absolute superstars, who are sourcing fabric face masks for affected communities within the COVID response, decided to work with women's cooperatives in the south of Thailand to source and procure directly from them, supporting women cooperatives, enhancing local livelihoods while still procuring the supplies needed. The second brief area I wanted to speak to was transportation and storage. Given linkages between humanitarian logistics and longer-term development, especially of transport infrastructure, I want to put out the idea that infrastructure is not gender neutral, and instead seemingly neutral questions of, for example, which roads to prioritize repairing or which railway connections to strengthen need to be informed by robust gender analysis. Understanding, for example, that women may be more likely to walk or use non-motorized transport, especially in rural settings, or that in urban areas, women tend to be more reliant on public transportation and are more susceptible to gender-based discrimination and violence within these spaces. Informing infrastructure and transportation within these areas can mitigate these risks. Before I leave you, I want to note that in the third segment, Ms. Murni from NADMA will speak to actually this central area in this circle previously around the role of supply chain actors and logisticians and what we can do to promote gender balance, as well as perhaps train them to refer protection issues that may be identified in the course of their work. Finally, I leave you with a number of tools and resources. When we share the PowerPoint deck, you have these links directly in the PowerPoint that may offer concrete guidance and ways that companies or humanitarian actors can better incorporate some gender responsive principles into their work in this area. Thank you again for your time and attention. I very much look forward to discussion later in this session, and I hand this over back to Amalia. Thank you very much.
Thank you, Ms. Prim. Ladies and gentlemen, please welcome Ms. Elisabeth Sidabutar, Humanitarian Program Analyst of UNFPA Indonesia, to present on our first case study, Enhancing Equality of Results. In this session, we'll be asking how can consultations with affected populations enhance effectiveness of prepositioning initiatives. Ms. Elisabeth, please.
Thank you so much, Amalia. Good afternoon, everyone. Today, I would like to share you about the regional preposition initiatives from good practices and lessons learned from Indonesia, where through these interventions, we saving women and girls in disaster situations. So one of the UNFPA imperative or mandate of vision is we have a dream, delivering a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. So this is even during humanitarian or emergency situations. So that's become our humanitarian visions, and also has become a humanitarian workers' visions and dream that every woman and girls affected by an emergency or crisis has the right to the protection and services she needs for health and well-being and dignity. This has become our mandate and aims to support the humanitarian emergency, especially during emergency situations. Over 50% of maternal deaths happen in countries with humanitarian situations. Maternal mortality in humanitarian crisis in fragile setting 1.9 times in the world average, and number of maternal deaths in these countries represent 61% of the total number of maternal deaths worldwide. So these emergencies actually heightened already that situations that significant risks, maternal death, GBV and harmful practices, unmet need for family planning is already significant risk, and it will be heightened during emergencies or humanitarian situations. That could occur complication of pregnancies or childbirth, destruction of the health structure, so it will have lack of the emergency obstetric care, less skilled birth attendants, or lack of basic information of sexual reproductive health, and gender violence, gender-based violence, including family violence. These crisis situations lead to increase the risk-taking behavior. So this is the background why we should support the sexual reproductive health and prevention and services of the GBV in emergency. So we have a transformative results, a dream from UNFPA that even in humanitarian or emergency settings, we can achieve zero preventable maternal death, zero tolerance for the GBV and harmful practices, and zero for unmet need for family planning. As you know that during humanitarian situations, families and communities are separated. Indonesia, including other Asia-Pacific country, also one of the countries that have living in the prone disaster areas. So during emergency or humanitarian situations, mechanism for protections, service delivery such as health, education, security or police are disrupted. Community support system and protection mechanism break down or maybe not function at all. So UNFPA think a lot how to provide protections for the women and girls. When a woman is alone in a relief camp and has lost her family due to a crisis, food and shelter alone cannot see her through the night. So we were thinking and then think aloud to put the dignity first. So supported by the Australian government, it's called Regional Prepositioning Initiatives. It started in 2015, piloting in 4 country offices. And then in the 2016-2020 is expanded to 11 country offices. So in 11 countries. So Indonesia is one of the country who has the opportunity to support it by the Australian government to provide and implement the regional preposition initiatives. And starting 2021 and 2024, Indonesia also, including the other countries like Bangladesh, Fiji, Myanmar, Sri Lanka, Philippines, Papua New Guinea, have the opportunity to continue the regional preposition initiatives. I will tell you later what is the preposition initiatives. So this is the countries. If you can see, most of the Asia-Pacific countries is an island, so it's very fragile with the earthquake, tsunami, and flood as well. So in the R2 tier here, there consists of the preposition, capacity building, advocacy, inclusions, and innovations that covers 7 countries. And then they also focus on capacity building and advocacy that support the Samoa, Solomon Island, Kiribati, Vanuatu, and Tonga. So we also have here, you can see in the maps that we have a regional warehouse, or we call it hub, in Suva and Brisbane to support the regional, the support during the humanitarian situations. We have a dream, and I believe you all have a dream when humanitarian occurs or disaster occurs. We have the outcome where the priority countries across the Asia-Pacific region are better prepared, more resilient to the emergencies, and people in these countries have their well-being and safety ensured in humanitarian crisis. And we also would like to have women, girls, and other marginalized groups like people living with disability, older persons who are affected by the emergency in priority countries have improved access to quality integrated sexual and reproductive health services and gender-based violence information and services. So this become a big dream from our regional preposition, especially to continue in 2021 in 2024. And yearly basis, we would like to have and achieve that the affected health facilities and service providers have received high quality, appropriate and inclusive sexual reproductive health and GB supplies within 72 hours of the onset of the crisis. If we were thinking that's too much, too big dream to achieve, but this is the idea of the regional preposition. By having appropriate or better preparedness, we can encourage the capacity of the health facilities, service providers, so they can provide and receive high quality and appropriate inclusive sexual reproductive health and GBV supplies, and they can provide services by receiving supported by appropriate supplies in 72 hours onset of the crisis. The other outputs that would like to have gradually increase in yearly basis is governments and partners also able to plan, prioritize, manage, and distribute supplies to meet sexual reproductive health and GBV services needs in emergencies, especially for women and girls. So because Indonesia have the opportunity started the regional preposition initiative in 2017, so we have discussed this closely with the government of Indonesia, Ministry of Health and Ministry of Women Empowerment, preparedness and coordination is the key to have a better humanitarian response. So during the pre-crisis, we have asked and also supported government-led. UNFPA Indonesia is one of the trusted partners. We co-lead the sexual reproductive health subclusters under health clusters, and also GBV subcluster under protection clusters. So under the Ministry of Health and Ministry of Women Empowerment, those subclusters during humanitarian preparedness and responses, the government led it with the support, strong support by the UNFPA. So we able also to identify the district prone areas by closely work with the DNPD and the Statistic Office, National Disaster Management Authority. So we have the estimated hazard populations, which area that have more prone disasters areas, geographical areas. So also through these clusters coordinations under government-led, we able to map potential partners. So where is the logistical prepositions needs? So through these initiatives, we forecast and procure the needs based on the discussion, mapping potential partners, who has strength in what, who has partners that potential supported in what. So UNFPA able to forecast and procure the needs, especially for women and girls. And we also prepare the warehousing, including warehousing that could be supported by the government, or transportation as hub for the supply chain that could be supported by the government. Through the pre-crisis preparedness as well, there are certain capacity development held, especially for sexual reproductive health and logistics trainings, and to ensure the preparedness assessment and logistics and supply chain, so it will goes to the right affected area in the right time. During the crisis, because we have better preparedness in advance, we closely work with the government since 2004 on to ensure the sexual reproductive health in emergency and GBV in emergency. So during the response, we gradually, or it's not easily, but the government-led activate the sexual reproductive health and GBV coordination. So it's usually less than 2 times 24 hours. We just activated in WhatsApp group or the informal coordinations at the subnational level. But if there's major disaster, then at national level, activated by the government. So collaborated with the government, we supported the initial rapid assessment, including the preparation of the logistics, including the warehouse hub in the affected areas. So warehouse usually and logistic preparation, we use that together with the government or our implementing partner like women-led NGOs, including the warehouse hub at the subnational levels. Target populations also appointed, and then distribution mechanism or channel mechanisms. So through the crisis, not only logistics we provided, but the capacity building, including provisions of sexual reproductive health and GBV services, and provision of the informations, educations, and the most particular important part is community engagement, to gathering inputs or feedbacks from the community as part of our accountability to the affected population. So we hear their voices. What is the result of this response? What is the effect of these kits distributions? And then during the recovery, since 2017, with the good lessons learned from Central Sulawesi in 2018, 2019, we ensure, and always UNFPA always take the opportunity to integrate the humanitarian response into to support or strengthen the integration into the family healthcare. So we take the opportunity, the humanitarian situations, we take the opportunity to enhance the capacity of the stakeholders in the national level or affected areas. We also train them on the outreach and data collection and how to have to meet the gaps data, that missing data that's occur in humanitarian situations, and provide strengthen the monitoring evaluation. So those capture as good practices and lessons learned, and then we do the advocacy to ensure the sustainability from the government side. And there are some activities that also funded by the government Central Sulawesi for the activities that we have started during humanitarian response. So what is the results and what as our lessons learned and good practices from Indonesia as part of the success story from the regional preposition initiatives? These initiatives, regional proportion initiatives, resulted that sexual reproductive health and GB supplies are prepositioned and well managed in national and regional hub. You can see the pictures on the left side is that's a warehouse in UNFPA, cooperative with the government of Indonesia in managing handing over, and then we also reporting to the Minister of Finance or the things that we provided through the government of Indonesia. In the middle is the reproductive health tents and the midwives in Central Sulawesi. And this is also collaborative works with the partners. So we have women-led NGOs providing the IEC material. Government provides the sexual reproductive health supplies like medication, supplies for rape cases or prevention of HIV or complications or that things supplies is provided by the provincial health offices or district health office, or maybe we can call it health centers, the nearest health centers into the affected areas. And UNFPA, through regional propositions, provided the tents, reproductive health tents, and supplies also provided by like AmeriCares, Yayasan Tuli. There are some partners on the middle. If you see that, it's very comprehensive. That's not only us, but is strengthen the partnerships. That's one of the results from these initiatives. But UNFPA provided, we can the right side, the kits. It's called interagency reproductive health kits that contains of the supplies and medicines to support the sexual reproductive health services and prevention of management of gender-based violence, especially for sexual violence. So this prepositioning improves efficiency and effectiveness. So since 2017 and until 2019, Indonesia, we calculated through our evaluations that there are 11 time fasters for the response time in Indonesia. We can provide the support or responses between 3 to 70 days during disaster response in 2017-2019. That if we compare with the regular procurement and support, it may take some 3 months or 4 months to provide response. So it will be not timely for the affected populations. The second one is the cost saving. It is important that we also have life-saving supplies in many countries. For example, we also have the stockpilings in regional hubs in Dubai, Fiji, Australia. Prepositioning has led to faster response and also help us saving money, because we can use the sea freight rather than air freight, and we can also maybe some UN agencies or some international agencies who's participating in this session, we can establish is called long-term agreements with vendors that can improve the quality of supplies by having this in advance. Using sea freight to preposition supplies as part of the preparedness rather than procuring emergency supplies and sending them by air at the time of disasters. It is definitely more cost and time efficient and help us to lower carbon emissions. So having these prepositioned supplies ready for shipment also help us respond to emergency last year when supply chains were disrupted due to COVID-19 pandemic. So Indonesia also, including the other countries, able to support the COVID-19 pandemic for continuation of sexual reproductive health and prevention of GBV because we have the supplies ready in 2020. The second results, supplies are customized to meet the needs of women, girls, and other marginalized groups like older persons, people with disability. In our commitment to ensuring accountability to the affected population, the regional preposition initiatives prioritize active participation and meaningful engagement of the women, girls, and community that we serve. Affected populations are consulted on supplies and on distribution strategies. This is to ensure safe and accessibility of the response strategies. In many countries, UNFPA creates other types of kits for mother. You can see in the right side, the green one, that's kits for mothers and newborn and older persons. In the left side, kit. The purple one is the kits for the older persons, and there are country also produced for transgender communities. And in Indonesia, maternity kits handed to out pregnant women during antenatal care visits in health center or in reproductive health tanks that we have seen before in the previous slides. These kits contains a large size of underwear, maternity clothes, and other hygiene supplies. in addition to information pamphlet of the danger sign of the pregnancy. So this is inside the kids dignity kits. This is one of UNFPA flagship product, is the dignity kit. Dignity kits contain of hygiene and sanitary items, as well as other items tailored toward to the local needs, women and girls of the reproductive age, in particular communities. So you can see here, dignity kits contain of basic hygiene such as towel, toothbrushes and toothpaste, and additional contents items like reusable and disposable sanitary pads, soap and laundry powder, so that women and girls can maintain their menstrual hygiene. And this is particularly important because disaster relief often doesn't prioritize this distribution of sanitary products for women and girls. Dignity kits help women and girls maintain their dignity during humanitarian crisis. Preserving dignity is essential to maintain the self-esteem and confidence. So this is very important to manage the stressful of the affected women and girls, because we provided things to protect their dignity. So women and girls can feel safer at night when they have to travel. So this is the sample. There are various in countries. From left to right is the Bangladesh. In the middle is Sri Lanka, and the right side is pictures from Myanmar. So different from countries. There are some countries put in the bucket based on the consultations with the women and the girls. There are with the backpack, and there are in dignity kits also. Inside those dignities also there are different information pamphlet on the GBV and sexual reproductive health, and there are usually we use the local languages, so community or women and girls will be easily understand the information sharing. In the Pacific, the kits were further customized for women and girls with disability. Based on the consultation, this disability-friendly kits contains hot water packs, inconvenience pads, waterproof seats, and plastic pants. And there are also first aid kits. You will have this presentation slide later on, so you can see what is the difference between maternity kits, disability kits, and then also kits for the girls. And this is the picture from Central Sulawesi. So it's very, we discussed this with the women, what's to be put it inside, and then to support the clothing and menstrual supplies and hygiene items. The third result is this is also very important, community engagement, hearing the voices, localization, and sustainability. There are three tents, that multi-purpose tents, women-friendly space, reproductive health tents in the middle, and the right side is youth-friendly space. So we engage women, strengthening capacity women-led NGOs, and also we also engage the midwives to asking feedback on the mechanism of the services that we provided to the pregnant women. We engage with the youth persons and then also adolescents, girls especially, and those spaces now currently still continue in Central Sulawesi, funded by the local government budget. Because it's like youth family space now formed as a youth forums now and integrated, it's called Posyandu Information Services funded by Provincial Health Office, including reproductive health tents, strengthening the health centers, and women-friendly spaces. There are some around 6 women-friendly spaces still continue function funded by the government, local government. So this is the one of the youth-friendly space that where girls can have stress or recreation activities inside. The fourth result is because we have the preparatory beginning. Yes, Amalia?
Gentle reminder that the time is up.
Okay, thank you. Maybe 1 minute to go, 2 minutes, yeah.
Just gentle reminder to wrap up the session, please. Thank you.
Thank you so much, Amalia.
Thank you.
The result fourth is government and implementing partner supply chain management. Capacity is strengthened across humanitarian nexus. So we trained them how to use the logistics, sexual reproductive health, and the last one is advocacy. National government are supported. This is the most appropriate result because through these initiatives and adaptation of SOP guideline, Ministry of Health allocated 2021 national budget for national preposition. So they have now the budget and they are in the procurement processing, and we are in the post consultation Ministry of Women Empowerment to have this as well in their budget. And we also liberate resources by strengthening collaboration with non-government development partners. I would like to see let you see this good dignity kids video, maybe the last one, Amalia.
During emergencies, families are separated, services are disrupted, and community support systems break down, putting women and girls at greater risk of violence. Without adequate clothing, menstrual supplies, and hygiene items, women and girls may be unable to access basic services, including humanitarian aid. That's why UNFPA distributes dignity kits during disasters, to reduce vulnerability and connect women and girls to information, support, and services. Dignity kits contain underwear, basic clothing, sanitary napkins, toothbrushes, toothpaste, soap, and laundry powder, as well as information on the services that are available and how to access them. Dignity kits can also contain flashlights, whistles, and radios. These can help women feel safer when they're displaced from their homes. We ask women and girls affected by emergencies what they need and customize the kits for different communities. UNFPA has been working with communities to create dignity kits for particularly vulnerable groups. In Indonesia, dignity kits have been customized for elderly people. In Bangladesh, they've been customized for transgender people. And in the Pacific, dignity kits have been created specifically for people living with disabilities. With dignity kits ready for distribution in disaster-prone countries across the Asia-Pacific region, UNFPA is ensuring that no one is left behind.
Thank you so much, Amalia. I hand it over to you.
Thank you, Ms. Elisabeth. Due to time constraint, please send your question to Ms. Elisabeth through the chat box, please, and Ms. Elisabeth will reply on your chat box. Yeah, we have one from Ririn. Ms. Elisabeth, do you mind answering the question via chat box instead? Oh, good then. Okay.
Sure.
Ladies and gentlemen, please welcome. Yes, thank you. Ladies and gentlemen, please welcome Dr. Riyanti Djalante, Head of Disaster Management and Humanitarian Division of the ASEAN Secretariat, and Ms. Murni Amin, Principal Assistant Director of the National Disaster Management Agency of Malaysia, to present our second case study, Enhancing Equality of Access. In this session, we'll be asking what can we do to enhance participation of women and people with disability in logistics. Dr. Riyanti and Ms. Murni, please.
Yes, thank you, Ms. Amalia, ASEAN Secretariat, for this opportunity. And I would also like to welcome Ibu Puan Murni Amin, Principal Assistant Director, National Disaster Management Agency, NADMA, Malaysia. So we have this discussion on the second case study, which I will have a structured conversation with yourself through some guiding questions with you. We would also like to say thank you very much for everyone to attend our second PGI meeting. And apology, probably you will hear in the background some noise with Azan. It's 3 p.m. In my time here. Yes, so please ignore and then let's focus on the conversation. Yeah, Ibu Murni, are you ready?
Yes, sure. Hi, everyone.
Yes, thank you. So I have two questions to guide our discussion here. So first of all, so as we know, Malaysia is the host of one of the DELSA warehouses and has pushed forward the conversation on the regional approach for humanitarian logistics. So, Ibu, what opportunities do you see within that work to integrate protection, gender, and inclusion lens? And what do you think would be the key benefits of integrating PGI lens into the, our regional warehouse system that we already have in place? So, welcome, Ibu Murni.
Yeah. So thank you very much, Ibu Riyanti. So I think when it comes to, okay, first of all, my name is Murni Amin. You can just everyone call me Murni. I'm the Principal Assistant Director from NADMA, Malaysia. So I'm actually coordinating all the international response and also all the Malaysian disaster managers, whether they are ASEAN ERAT or whether they are UN UNDAC. So whoever going to be deployed for the international response and also whatever relief from the Malaysia to the affected states will be going actually coordinated by my team. So as throughout the experience and whatever I've been, been deployed to Central Sulawesi and also numbers of simulations and exercises, I can see the main role when it comes to protection, gender, inclusion. So when we see that lens, it's actually that women and PWDs or whoever's actually concerned on that particular issues actually need to participate actively and also influence in the decision-making processes, which for me, it helps to prevent gender discrimination and also resolve the conflict without the violence. And I always see it's in the three ways. One would be the regional solidarity. It is really important for all the ASEAN, especially through the ACDM, ASEAN Committee on Disaster Management, to work together to build up a policy and also operationalized by the AHA Center and also supported by all the ASEAN member states. The second one would be, I always believe it is really important for the national commitment to actually to adopt and also, implement whatever policies and we operationalize it at the national level, especially at the affected states. And most important also, the third one would be the individual effort. So by all the disaster managers, always use this PGI as the guiding principles and also become like pretty much, we always see is the most important thing, make it as one of the agenda and the guiding principle throughout the agenda or the coordination and also the implementation level, method. When we see also even at the regional level, we can see under the NADMA itself, strengthening regional humanitarian supply chain and also have been thought through. We can see in ACDM, we also have the specific ACDM working group on prevention and then, preparedness, response and recovery. We always discuss it. And we can see Ibu Riyanti. We can see also our executive director of AHA Center, Ibu Adina Kamal. And we always see Kun Amy from the ACDM for Thailand always be there and then always highlighting this guidance principle on how exactly we need to make sure the PGI always be will be see through the perspective from that. So we actually pretty much not worried because we have these strong personalities in this policy level, but we want to make sure this strong personality also actually exists at the operation level and the tactical level. So that's why Malaysia are actually honored to host one of the DELSA warehouse, and throughout from there with the facilities, we have the coordinator in the UNHRD itself, which is also a woman, and in NADMA also we have like about 3 people who essentially women, strong people to actually support the mobilization of DELSA to any affected states by request, and also we have numbers of Iraq. Malaysian Iraq, we have about 11 women in Iraq, but somehow they are actually active and also I may say proactive. Whenever they heard there's people who needs help or wherever there will be a mission to assist to affected states, they will actually call me, and then whenever we want, if there any space or if there any matters that they will able to support. So doing so, we actually Malaysia we have we are rich of these strong women, and in Malaysia we call it Sri Kandi. So they're actually always willing to help. As people may say that actually when it comes to logistics, there's not many people or women actually involved. But I think for Malaysia, it's just important to set in every mind, including men, to have that PGI become the guiding principle. I think that's the most important part. We may say like when it comes to the regional preposition. That one is of course important. We have a DELSA, we have numbers also in China and also in Philippines. We have numbers of Iraq actually have been trained by the AHA Center, specifically for the humanitarian logistic. Malaysia have 5. 2 of it actually proactively focus on the logistics also. And we also have like numbers of regional initiatives, including the ASEAN USA prospect. Also, we have numbers of that now actually focusing on the increase the efficiency of the NDMOs, actually whichever that carrying out the logistics and the supply chain management. I do believe there have numbers of initiatives that have been done by at the regional level, but somehow national commitment also need to support them. So NDMOs have to play main role. We are lucky now, actually, NDMOs always willing to support us and to always send out us an email, to see whether to check what exactly the needs at the national level. So, and then NDMOs plays the main roles to become the focal point for the national level to, inform back what exactly. And at the same time, if to see also to support this perspective that we need to see it holistically, not only throughout the needs only, not only at the PWDs, but always to see from everyone. That's why the inclusion is really important. We can see also, the thing that I like also is when during the audits, the simulation also, in numbers of simulation done by the UN or also done by the AHA Center. So there are numbers of injection, simulation injection that they also includes those the PGI perspective. So everyone actually, even though especially men actually become the responder, they actually also can see, oh, this is the concern. So we need to check on the protection. We always need to be alert on the gender, specialties, the PWDs, and any other special needs by these vulnerable people. So I really like that. And I also like when AHA Center also have these specific capacity programs, not only with the AHA Center Executive ACE. So it's like pretty much 5 or 6 months intensive on-job training focus. And throughout this course, they're actually always highlighting these PGI lenses throughout the courses. I really love that course actually. And also throughout the ASEAN Iraq program courses, they always, even though we focus actually, the main focus on the information management, but there's always the protection, gender and inclusion lenses that we actually have been included into the modules. The thing that I would love to see, I think now at the regional level, we more support from the national commitments and national NFP, and then of course from ourselves, we need to also, we as a disaster managers, of course need to always to self-improve our competency. Like for now, even though the topic, whenever we have the topic with women, okay, the participant will be from women only and the panel will be on women only. Somehow, I think it's not just about the gender. We need to also to make sure the men also have this guiding principle when it comes to thought. Whenever they want to do to send out all the distribution, or even though they want to prepare or planning for any exercises or any response, they need always to make sure the PGI become the guidance principle. And that's what always Malaysia embrace. And we hope that every countries throughout the world also will also embrace the same thing. Thank you.
Yes, thank you, Ms. Murni, on the responses. So if I may summarize, I think here you have comprehensively outlined the progress at the regional level, national level, and at the individual level. But you also said, outline some of the things that needs to still be improved at this different level. Yes, I think I kind of agree and support that the progress at the regional level have improved. However, as you can rightly say, it may still focus at the policy level and higher up, and we need this PGI consideration more at the operational level as well. Yeah.
True.
The second, I think, responses that you have here on the national commitments, as you have also outline, for example, specifically for NADMA, I think there is already very strong commitments to improve PGI to the organization, to the activities of the organization. But of course, again, I think what needs to be done is that we have this equal commitment, national commitments by the 10 member states. And finally, at the individual level, you have commented a lot on the works by AHA Center, especially on this training, capacity building, simulations, which already include some PGI lenses. However, at the individual level, you call for a more equal understanding that between men and women. So gender issue is not an issue which needs to be considered by the female personnel of only. Yeah. Thank you very much, Ms. Murni. Then let us move to the second question, follow-up question from your responses. But I think you have also rightly touched upon some of these responses to this question. So we know that disaster management and specifically also logistics is a field where women and female representation is very much lacking or underrepresented. Yeah. So Ibu Murni, I think you have a very broad and long experience working for NADMA. So from your experience, what are some concrete steps for people in this room, in this discussion that can take to promote participation of women within the field of disaster management in general, but also in logistics specifically. So welcome, Ms. Murni.
Okay. The thing I think would be when it comes to the step, I think I do believe in the three level. One, of course, at the strategic level. So of course, we need to look to have more better policies, the procedures, especially when it comes to, because like when whoever doing the operation down, they actually always refer back to the manual, refer back to the SOPs, refer back to the policy and the procedures. So it is really important at the strategic level, actually already put it as a guidance principle, and then highlighting that they need to make sure these have been highlighted and be taken care well by at the operational level soon later. So, for example, we can also check on we can address at the burden of unpaid care work. So where this policy not only will help women more to be recruited and stay in the field, but also men as well, actually. So it's actually, for example, by allowing those of the deployment to reimburse the cost of the childcare, or allowing adequate time for the families to ensure the caregiving needs are met prior to the deployment. I know it's pretty much like some easy, but somehow like for me or my colleague also, whenever we want to go for the deployment, we need to take care of our family and our child first. But at the same time, because like if we're taking care of our family, and we can actually have like more open heart to take care of other people also. I know people in the humanitarian action, humanitarian field, they have a big heart. They love to love everyone. They love to help everyone. But at the same time, we need to take care of ourselves. So we need to have a better policy procedures for the deployment. At the same time, also, we need to have a better policies and procedures for people who are actually taking care or supporting us at the field. Even though they are local people, even though are actually volunteers, but we need to support and have a better policy to make sure the PGI actually becomes the guidance principle actually during the response. At the operational level, of course, we need, especially disaster managers. I do believe that it's not only at the roles of disaster manager, it's actually pretty much roles and effort from everyone. But somehow, disaster manager as a coordinator during the response actually need to address the gender issues within the safety provisions for women in the humanitarian actions, not only for the volunteers, not only for the responders, not only for the workers, but also for the people, the vulnerable people. I may see, even though whenever we go to the field, sometimes people are pretty much they're more focused on giving food for the survivor, rather than also taking care on the light. Is there enough light or enough lock at the toilet, or whatever, through the access to any place, kitchen sometimes, because during the night people always say it's okay, no worries, maybe we already provide food, so that's the most essential one, without they actually thought that toilet also a place that always people will go, actually, because it's a nature work. So but somehow they always, sometimes it's okay if they don't have enough lot, it's okay, like it's a disaster time, so we just use any pail or anything that actually to just to be the lock for the door, and that's why it is important to set. So for example, NADMA always provided this checklist. So whoever actually go for the evacuation center or the shelter, check whether this kind of protection actually have been taken care well or not by the camp coordinator or the camp manager. And that's why field standards would be one of the best consider a manual for all the camp managers to check whether this safety, this protection, and this gender issues, gender matters actually have been taken care well by whatever they can, they have been actually been managed. And then I think the most we go for the at the operational level also. That's why Malaysia adopt the UN cluster, where the protection cluster actually one of the working group, or also the team that actually always taking care and look, always addressing all those gender issues. And I think that one also is really important. So I still remember when I used to meet Miss Isabella during the Central Sulawesi. I'm amazed with her support and effort during the response, and it's actually one of actually have been inspired me to do the same thing in Malaysia also. So thank you very much. Also, I mean, personally, I would like to thank you, Miss Isabella, also for actually highlighting on that. And the last one, I think, at the tactical level, of course, we need to address the gender stereotype and also those unconscious bias. When I always feel that whenever we do the response or coordination response down, there's always men. It will be like always me, the one with the girl, and then the rest would be the man. But somehow doesn't matter, voice out everyone. So even though we are like, we are just a lady there, but somehow it doesn't matter. We don't have to speak like a man. We don't have to do that, because like we just need to be, because as we know, our husband actually listen to us, so they actually just pretty much like give the money, but the rest, whatever we want to buy, whatever we want to cook, is pretty much by women, actually, by the wife. So I always think of that whenever I go into the meeting. Everyone is pretty much a man, so it's okay. I'm just a normal little girl there, but somehow I always pick up whatever I think is necessary. Those gender issues, those PWDs, highlighting, address whatever we think that. Because like without our voice, so maybe they actually forget or pretty much didn't see. So that's why it is important for our voice to speak out during the meeting. It's not like we'll become the feminism or whatever. It's not like that. It's just like, because we are now, everyone knows that we are here to support other people. Those vulnerable people, we're actually supporting others by giving them a voice. So that's why I need to speak up in the meeting. So I think that will be one of pretty much my idea. I do believe others in this session, I think everyone have a more concrete suggestion. Of course I would like to hear more everyone, because like this is pretty much my opinion. I do believe everyone have more concrete suggestion. Please do maybe share with me, especially in the chat box. And of course, I know we do have a limited time, but I would love to see more in any suggestion in the chat box. Thank you very much, Riyanti.
Yes, thank you very much, Murni. I think we can see you're very passionate in this field. Yeah. So I think to summarize also on this responses for this second question, let me start from I think the last. We need to be a PGI advocate on every activities that we do on all circumstances, yeah, and if necessary, having a lot of courage to speak up. And this is very important, yeah. Not only formally but also informally in the activities. I think you highlight the role of Malaysia's participation for the sphere standard and also for this UN cluster, the protection cluster, which ensure that consideration of PGI is highlighted in the during the operational level. And I think here having some approach on the checklist on the protection of PGI during in the emergency situation, I think it's very important. Then at the strategic level, the need for better policies, procedures, manuals, SOP, and guiding principles. And also for better policy support for family, yeah, not only to men, to female, but men or male personnel also during deployment, so they can focus on giving supports to the affected community, while their needs for when they have to leave their family and the circumstances behind are also taken care of. I think I was informed that I think we have reached the end of our discussion. Thank you very much, Ibu Murni, and we are looking forward to also meet you and have you as the resource person for our future activities.
Thank you very much, Ibu Riyanti. Thank you, everyone.
Thank you. Then let me return the floor to the MC. Welcome, Amalia.
Thank you, Dr. Riyanti, and thank you, Ms. Murni. A really great session indeed. Okay, distinguished participants, this will be our last session for today's virtual road trip. I would like to invite Ms. Maria Holtsberg, Regional Advisor for Humanitarian Action and DRR from UN Women Regional Office for Asia and the Pacific, to lead the next session. Ms. Maria, please.
Thank you very much, Amalia. Thank you so much to all the speakers and for the conversations also going on in the chat. So this part of the session is going to focus specifically on what type of recommendations we want to take forward to the plenary of this session. And to do so, I'm going to facilitate with you a Mentimeter exercise. Many of you are already familiar with this, but I invite you all to go pick up your phone, which I think you have, or you can go on the computer and go into menti.com and use the code 41883828. So if that can be put into the chat, I invite you all to start responding to the chat. So I will walk you through a few activities, and we're doing this so that we can gauge an understanding of what type of recommendations we want to take forward from this event. I know Dr. Riyanti has already shared a few things to take forward, but we want to also hear specifically from you also. So we're seeing people are responding. We have Red Cross, we have government and NGOs. I'm having problems logging in, but that will be rectified soon. Here we go. So the code is 41883828. For those of you who are opting to not do this, just try it. It is an important part of your voices being heard. So I believe we have. I don't think we have all participants yet who are responding, but we may be in good position to go to the next question. May I also say that you can jump onto Menti at any time. So even if you missed that first time, please join now. So the question here is, in my experience in humanitarian logistics, my organization currently, so one side of the spectrum is does not integrate PGI at all, and the other question is fully integrates PGI at all. And PGI, as we know, is protection, gender, and inclusion. So is your organization, if engaged in logistics, working on have some elements of protection, gender, and inclusion, or does it not? And this is where we're doing to get a bit of a temperature check of where colleagues sit. And if your organization does not do humanitarian logistics per se, are you engaging in advocacy around those issues? So we're seeing that we have 21 people responding. We encourage maybe some of those 38 other ones to join, so we can get a good response, so that we can take forward to the plenary. It still looks like a great number of you do actually integrate protection, gender, and inclusion issues, and that it looks encouraging from the perspective of those of us who've organized this panel. So we're very happy to see this. At the same time, we do think that this is clearly one of those issues that we need to continue doing advocacy for. We may want to move to the next question now. So this is going to give you an opportunity, friends, to write your own perspectives of what you've heard today. So please write, my key takeaway from today's presentation is, and then you can write what it is. And you can write a short answer. We see the importance of pre-positioning products that are focused for women and girls and persons in all their diversity, tailored. We're seeing that we want women-friendly logistics support. We're talking about what the content is of dignity kits, so the type of products that should be procured, but also distributed as part of a humanitarian response. The importance of bringing forward protection, gender, and inclusion across the full logistics cycle. We're talking about protection, gender, and inclusion being non-negotiable in our programming, and that there's good progress on a policy level, but maybe not enough on the operational side. There's a conclusion that tailoring the logistics preposition with protection, gender, and inclusion will be life-saving and will save more lives. It's important to consider women and people living with disability needs when providing logistic support. Also, we're hearing that international cooperation is important as part of a humanitarian response, and making sure that we strengthen capacity and inclusion of gender and vulnerable sectors into the logistical support. This is very rich, and thank you so much for sharing these perspectives. And there's a lot to take forward as part of our general recommendations to the plenary. Can we move to the next question now, please? So here you're given the opportunity to vote for activities that you think would be important. And the question that you're put before you is, regional initiatives should prioritize, and then you have 5 different proposals to further integrate protection, gender, and inclusion lens into logistics. And I believe you can select more than one. And we see here how on the slide how your reflections are being populated, and it looks like we're really seeing a dual approach. We want to talk about ensuring capacity development among the existing logistics sector components, and that looks like it has more of a prioritized action on your side. However, we are also noting that we want to look at linking networks with women-owned enterprises. So that speaks to making sure that the actual logistics sector has a robust understanding of integrating protection and gender. But it also means that we need to bring, in order for this to be happening, we need to bring in women-owned businesses, women-owned enterprises. We're talking, a majority is also looking at the development or maybe amplification or use of guidance and tools. And that also is included into when we say assessment tools. We're also looking at development of strategies and policies. And for this, we think that the Protection, Gender and Inclusion Technical Working Group will be in a great place to amplify these type of strategies and policies. So this is a great picture of the type of priorities that you colleagues are putting forward. We also note that facilitating exchange of good practice between countries is maybe less prioritized in relation to capacity development on protection. We are also noting that this doesn't mean that the actual knowledge sharing component isn't important into ensuring that this work is being integrated into logistics. So thank you very much. We see that definitely the majority are feeling that capacity development is something that needs to be done. So this is something that can be taken forward by our colleagues when we are developing work plans and prioritizing actions. So we can move to the next one. So this question is more about how research will help you in your work. And we are proposing here, or the question is, academia can support my work to integrate a protection, gender and inclusion lens into logistics by developing research or presenting evidence on what? What is it that you think you would need some evidence around? So people are typing. We see different perspectives coming up. Keep typing, colleagues. This is maybe requiring you to do a little bit more of thinking. What we have thus far is we would like to see evidence on or developing research on need assessment and satisfaction surveys of the beneficiaries of a response. So that ties into positioning of the logistics support. We're asking for support in making sure that we get feedback from community, and that is tied to having speaking to the affected populations. We have a question on what happens if we prioritize women-owned businesses. Will there be a difference in how we conduct our logistics support? We would like to get more support on developing the actual business case for more protection, gender, and inclusion work in logistics. And maybe that is tied to the point raised before on, well, what happens if we focus on with a women-owned business? Looking at assessing the gender gap between logistics supply and number of women in the community. And we would like the research in general to build the case for better integration of protection, gender, and inclusion, and addressing sexual and gender-based violence at all levels of humanitarian organization. We would like support or evidence on formulating voices from women and girls for advocacy or in development of action plans. We would like support on standard competencies in humanitarian logistics certification that ensures that protection, gender, and inclusion is integrated into curriculum. Some of these proposals are ties into what we want to do within the tool section, and some are in looking specifically at maybe some programmatic ideas, and some are much more on, well, what is the hard data that we need? We need baseline data, someone mentioned, which is a great point. Okay, good. And then this is you given an opportunity to give one quick reflection on what you heard today. So what did you hear or today that really sparked you wanting to share something that you've developed in your organization or in your work that would amplify the ideas or the content that was shared today? So who wants to share what they have? This can be a website or a resource or a tool that you yourself work with, or similar. It's a tall order because we got a lot of resources shared with us today. But if there's other things that you think would be useful for colleagues to know that you in your country have used, or that you in your organization has used, that would be great to share. We will, because we're a bit short on time, we will close this section, but please share in the chat when you, if you have any additional ideas, and I will hand over to Amalia for the closing. Thank you so much, colleagues.
Thank you, Ms. Maria. Distinguished participants, we have reached the end of our virtual tour. A photo session will immediately follow after the closing remarks. Please be on standby to turn on your camera. Now, may we invite Dr. Riyanti Djalante, Head of Disaster Management and Humanitarian Assistance Division of the ASEAN Secretariat, to deliver the closing remarks. Dr. Riyanti, please.
Thank you very much, Amalia, and also thanks again to Ms. Maria for a great discussion and facilitation for the Mentimeters. I think it's very clear on the steps that we need to do as a whole. And allow me also, chairs, participant, to read the concluding remarks for today's afternoon's meeting, PGI Virtual Road Trip Session 2 on enhancing accountability and effectiveness of humanitarian logistics through a protection, gender, and inclusion lens. So esteemed colleagues, good afternoon. So we have come to the end of our second session of the virtual road trip on protection, gender, and inclusion, or PGI in disaster management, titled or specifically focusing on enhancing accountability and effectiveness of humanitarian logistics through a protection, gender, and inclusion lens. I would like to express my appreciation to our partners from UN Women for another successful virtual session. I'm pleased to see that so many colleges from across the sectors, disaster management, gender, social welfare, and also, of course, other organizations that have joined us for us to co-create knowledge in this area as we continue this journey. Thank you very much for joining us. In today's session, we have seen practical ways to enhance effectiveness and accountability in humanitarian logistics, to ensure that the life-saving needs of women and girls, and also a person living with disability in humanitarian crisis, are met through pre-positioning supplies in disaster-prone countries and regional hubs, to ensure to respond to sexual and reproductive health and gender-based violent needs, and learn from our colleagues from NADMA Malaysia on how diverse representation within logistic teams can be more effective to reach to marginalized group within affected population level. The humanitarian logistics sector has a key role to play in enhancing the access to and benefits of aid for all in disasters, particularly those who are most marginalized within affected populations, such as women, children, persons with disabilities, people with disabilities, and the elderly. So thank you very much for everyone's active participations in the session. We hope we can strive in applying the PGI lens in our work program to increase the speed and quality in meeting life-saving needs when disaster occurs. So as we close, we kindly invite all participants to first let us know what you think and how we can improve. So a link to a webinar survey is being placed in the chat and will also be circulated to participants immediately after this session. Then second, kindly also save the date and join us for another interesting session scheduled to be held on June 29th on PGI and community-based disaster risk management. So you can register through the link provided in the chat box. Another thanks to the chair, Director Panapa, of your always active participation and contribution and availability for our meetings, and also to the colleagues of AHA Center for the great works of this session, but also throughout the HELiX programs that we have offered the next 2 or 3 days. So once again, we thank all organizers, speakers, and participants for taking the time to be with us today, and we look forward to seeing you at the next session. So thank you very much.
Thank you, Dr. Riyanti. May I invite everyone to turn on your video for a quick photo session. We'll give some time to the other participants to turn on their camera. Okay. A photo will be taken in the count of 3. 1, We have more participants coming in. One more second. Okay, in the count of 3. 1, 2, 3. Thank you, everyone. Maybe one more with the one ASEAN, one response pose.
As Amalia seems to be frozen, I confirm I've taken that snapshot with the one ASEAN, one response pose. And let's see, Amalia, are you back? If not, with many, many thanks to Amalia, who has otherwise been serving as an excellent MC throughout the session. I'm really pleased to close the session. I hope everyone has an excellent afternoon, and thank you once again for joining us. Thank you and goodbye.
Thank you, everyone. See you in the next session.
Thank you.